Welcome to the BanishCancer channel. I'm your guide, Sarah, and today we're exploring a rare but serious bone tumor called Adamantinoma. It grows slowly, but its impact on the body can be significant. Early detection and proper treatment are essential, so let's break down what you need to know. Adamantinoma primarily affects the tibia, the larger bone in your lower leg. It accounts for less than 1% of all bone cancers and under 0.5% of skeletal tumors. Despite its rarity, it can spread to the lungs, lymph nodes, or other bones. About 15 to 20% of cases involve lung metastasis, while spread to lymph nodes and other bones is less common. This makes early diagnosis critical. There are two main types of adamantinoma. Classic adamantinoma usually affects adults over 20 and shows distinct features on imaging and biopsy. Differentiated adamantinoma appears almost exclusively in younger patients and includes variants like osteofibrous dysplasia-like adamantinoma. Understanding these types helps doctors choose the right treatment. Most cases develop in the midshaft of the tibia, but it can also appear in the fibula, femur, ulna, radius, and rarely in the spine, ribs, or foot bones. If you experience persistent pain or swelling in these areas, especially in the lower leg, it's important to consult a specialist. Adamantinoma grows slowly, but it can be locally aggressive. Imaging often shows a multilocular lesion with sclerotic margins and overlapping radiolucencies. These features point to a slightly expansile and osteolytic tumor. You might notice gradual swelling that persists for years. Pain may or may not be present, which makes it easy to overlook. Despite its slow pace, the tumor can cause serious damage if left untreated. Metastasis is a concern. While not common, it does happen. Risk factors include male gender, pain at diagnosis, short symptom duration, and age under 20. Recurrence is also possible, especially after incomplete surgical removal. That's why early and thorough treatment matters. Histologically, adamantinoma is unique. It contains epithelial cells arranged in patterns like basaloid, tubular, spindled, and squamoid. These help distinguish it from other bone tumors. In some cases, it may resemble osteofibrous dysplasia, with spindled cells forming storiform arrangements alongside bone fragments. This makes biopsy and expert analysis essential for accurate diagnosis. Symptoms include pain and swelling, often in the tibia. You might feel a slow-growing lump that causes discomfort or even fractures. Pain can persist for months or years. Swelling may lead to visible deformities like bowing of the bone. If the tumor weakens the bone, fractures can occur, affecting up to 23% of patients. These fractures cause sharp pain and require immediate care. Restricted movement is another issue. As the tumor grows, it can interfere with joint function and pressure surrounding tissues. Walking may become painful, leading to a limp. Over time, stiffness and limited mobility can affect your daily life. Other symptoms depend on location. You might experience bone deformities, neurological issues if the spine is involved, or a painless lump that's easy to ignore. These signs often develop slowly, so staying alert is important. The exact cause of adamantinoma is unknown. One theory suggests it arises from misplaced epithelial cells during development. Another links it to osteofibrous dysplasia, a benign bone disorder. Genetic studies show extra copies of chromosomes 7, 8, 12, 19, and 21 in tumor cells. Mutations in the p53 gene have also been found, which may explain the tumor's growth and spread. Risk factors include age between 20 and 40, male gender, and a history of osteofibrous dysplasia. These don't guarantee you'll develop the tumor, but they help doctors identify who needs closer monitoring. Treatment centers on surgery. En-bloc resection removes the tumor along with a margin of healthy tissue. This reduces the risk of recurrence. In some cases, nearby lymph nodes are also removed. Limb reconstruction or salvage techniques help restore function and appearance. Wide excision with clear margins leads to excellent outcomes. Studies show a 10-year survival rate of 87% for patients who undergo limb-saving surgery. However, recurrence can happen, sometimes decades later. Limb-sparing surgery is preferred over amputation. It preserves mobility and improves quality of life. Reconstruction options include distraction osteogenesis, allografts, vascularized fibular autografts, or metallic replacements. These techniques allow you to keep your limb and maintain function. Amputation may be necessary if the tumor recurs or limb salvage isn't feasible, but it doesn't improve survival rates compared to limb-sparing surgery. Radiation and chemotherapy play a limited role. Radiation may help relieve symptoms like back pain, but doesn't shrink the tumor. Chemotherapy has shown little impact on tumor size or survival. These treatments are rarely used as primary options and may be considered only in specific cases. Long-term management is essential. Most patients do well after surgery, especially with complete tumor removal. 5-year survival rates range from 95 to 98%. 10-year survival is also high. But recurrence and metastasis can happen years or even decades later. That's why regular checkups and imaging are critical. If the tumor returns, additional surgery may be needed. In rare cases, radiation or chemotherapy might help manage symptoms. Mortality rates range from 13 to 18%, but early and thorough treatment improves outcomes. Staying proactive with follow-up care helps maintain quality of life and reduces complications. Adamantinoma is rare, but with the right care, it's manageable. If you notice persistent pain, swelling, or a lump in your leg, don't wait. Talk to a specialist, get the right tests, and take action early. This has been the BanishCancer channel.